Have you ever been woken up in the middle of the night by a painful leg cramp? That sharp, tightening feeling in your calf or foot that makes you jump out of bed and rub your leg desperately, hoping the pain will go away? If this sounds familiar, you are definitely not alone. Millions of older adults experience these sudden muscle spasms, and they can be frustrating, exhausting, and even frightening. Imagine finally drifting into a peaceful sleep, only to be jolted awake by a pain so strong that you cannot move for a moment. It is more common than you might think. But here is the good news. In this video, we are going to explore the top 3 foods that can help reduce leg cramps in seniors. Stay with me, because understanding the science behind these foods might be the key to calmer nights and healthier days. Hello and welcome. My name is Dr. Emily Carter, and I am so glad you are here today. On this channel, we explore health topics that truly matter to you, always with the goal of making complicated information clear, practical, and easy to apply in your everyday life. The information I share with you comes from careful research, trusted medical publications, and evidence-based studies. So you can feel confident that what you are hearing is reliable and well investigated. My mission is to help you understand your body better, make healthier choices, and live with more comfort and energy, no matter your age. Leg cramps might sound like a small problem, but as many of you already know, they can have a big impact on quality of life. That is why in today's video, we are going to uncover not only the top 3 foods that can make a difference, but also why these foods work and how you can include them in your daily routine. You will see that preventing leg cramps is not about complicated solutions, but about smart, consistent choices that support your muscles and overall health. Before we dive in, I want to invite you to stay with me until the very end of this video, because I will also be sharing extra tips that many people overlook when it comes to preventing cramps. And while you're here, please take a moment to give this video a like, subscribe to the channel, and share it with friends or family members who might also struggle with leg cramps. Your support not only helps this community grow, but also makes sure that more people can benefit from clear and trustworthy health information. So, if you are ready, let us begin exploring why leg cramps happen and what you can do starting today to take back control of your nights and your mobility. Let us take a moment to really understand the problem we are talking about. Leg cramps are sudden, involuntary contractions of the muscles, most often in the calves, the thighs, or the feet. They strike without warning and can last from just a few seconds to several long, uncomfortable minutes. While anyone can experience them, they are especially common in older adults. In fact, studies suggest that nearly 1 out of every 3 people over the age of 60 report having leg cramps regularly, especially at night. Imagine that almost a third of seniors are dealing with this discomfort, often in silence. But why do leg cramps seem to appear more often as we get older? Part of the answer lies in the natural changes that happen in the body with age. Muscles lose some of their flexibility and strength. The nervous system responds a little more slowly, and circulation can become less efficient. Dehydration becomes more likely, especially if you are not drinking enough water or if certain medications increase fluid loss. Add to that the possibility of low levels of important minerals like magnesium, potassium, and calcium, and you have the perfect conditions for a painful spasm. Think about it for a moment. Have you noticed that your cramps come more often at night, just when your body is trying to rest? Or maybe after a long day of walking, standing, or even sitting too much? These patterns are not random. They tell us that cramps are often linked to how our muscles and nerves are working throughout the day, and how well they recover at night. The truth is, leg cramps are not only uncomfortable, they can also take a toll on confidence and independence. Waking up in pain night after night makes it harder to get proper rest. Being afraid of sudden cramps during daily activities can make some people less active, which ironically can make cramps even worse. And while most leg cramps are harmless, they can sometimes be a signal that something deeper is going on, such as circulation problems or side effects from medications. This is why it is so important to understand them, not just accept them as a normal part of aging. When you know the causes, the warning signs, and the strategies to prevent them, you take back control. You can reduce the frequency, lessen the intensity, and most importantly, feel more confident in your daily life. And that is exactly what we are going to explore step by step in this video, starting with a clear definition of what leg cramps really are. So let us begin with a clear definition. A leg cramp is a sudden and involuntary contraction of one or more muscles in the leg. Most of the time, it affects the calf muscles, but it can also occur in the feet or even in the thighs. The sensation is often described as sharp, intense, and almost paralyzing, as if the muscle has turned into a rock. The cramp usually comes on without warning, sometimes waking people from deep sleep, and it can last anywhere from a few seconds to several minutes before the muscle finally relaxes. It is important to distinguish leg cramps from other types of pain in the legs. For example, muscle soreness after exercise is different. That soreness builds gradually and usually feels like stiffness or tenderness. Leg cramps, on the other hand, strike suddenly and are much more painful in the moment. They also differ from conditions like restless leg syndrome, which causes an uncomfortable urge to move the legs, but does not involve the sharp tightening of the muscle itself. Knowing these differences helps us understand that a cramp is a very specific event, caused by a rapid miscommunication between the nerves and the muscles. From a biological perspective, what happens is that the nerve controlling the muscle sends signals that make the muscle fibers contract. But those signals do not turn off when they should. The muscle stays locked in a tightened state until the electrical activity calms down. This explains why the affected muscle often feels hard to the touch, and why stretching or massaging it sometimes provides relief. The cramp is essentially your muscle being stuck in a state of contraction. Now, while most cramps resolve on their own, they leave behind a feeling of soreness or tenderness in the muscle that can last for hours. This is why many seniors describe waking up not only from the pain, but also facing fatigue and discomfort the following day. Understanding this definition is the first step, because once we know exactly what a leg cramp is and what it is not, we can better explore the causes, the warning signs, and the strategies that make a real difference in preventing them. Now that we know what a leg cramp really is, let us talk about the most common causes. The truth is, leg cramps can have several triggers, and often more than one factor is involved. One of the biggest causes is dehydration. When your body does not have enough fluids, the balance of electrolytes in your blood and muscles gets disturbed. Electrolytes such as potassium, sodium, calcium, and magnesium are essential for proper muscle contraction and relaxation. Without the right balance, muscles are more likely to spasm. This is why cramps often appear during hot weather, after sweating, or when someone simply forgets to drink enough water throughout the day. Another common cause is an imbalance of minerals, especially magnesium, potassium, and calcium. These nutrients act like tiny messengers that help the nerves and muscles communicate. Imagine trying to send a text message without a proper signal. The message would not go through clearly. In the same way, without enough minerals, the signal between nerves and muscles becomes disrupted, leading to involuntary contractions. Seniors are at a higher risk because appetite changes, restricted diets, or medications may reduce the intake or absorption of these nutrients. Speaking of medications, some of the most frequently prescribed drugs can increase the likelihood of cramps. Diuretics, for example, are often used for blood pressure or heart conditions. They make the body lose fluids and electrolytes more quickly, raising the risk of nighttime cramps. Cholesterol-lowering medications such as statins have also been linked to muscle discomfort, including cramping in certain patients. This does not mean these medicines should be stopped, but it does highlight the importance of discussing persistent cramps with a healthcare provider. Poor circulation and nerve issues are other contributors. When blood flow to the legs is limited, the muscles do not receive enough oxygen and nutrients, which can make them cramp. Conditions like peripheral artery disease, or even sitting for long periods with crossed legs can reduce circulation. Nerve problems, such as those related to diabetes or spinal issues, can also increase the frequency of cramps by altering the communication between the brain, the spinal cord, and the muscles. Finally, lifestyle factors matter. Being too sedentary weakens the muscles, making them more prone to spasms. On the other hand, overexertion, such as exercising too hard without proper stretching, can overload the muscles and trigger cramps. Even something as simple as sleeping in an awkward position with your feet pointing downward can increase nighttime cramps by keeping calf muscles shortened for hours. As you can see, there is rarely a single cause. For most seniors, it is a combination of dehydration, nutrient imbalances, medications, circulation issues, and daily habits. Recognizing these causes is the key step toward prevention, and it sets the stage for understanding the symptoms and warning signs we should all be paying attention to. Now, let us talk about the symptoms and the red flags you should never ignore. The most recognizable symptom of a leg cramp is the sudden and sharp pain that seems to lock the muscle in place. Most people describe it as if the muscle turns into a hard knot. If you touch the area during the cramp, the muscle often feels firm and tense, almost like a rock beneath the skin. These episodes can last anywhere from a few seconds to several long minutes. Once the cramp eases, the muscle may remain sore or tender for hours afterward. Most leg cramps are harmless and pass on their own, but there are warning signs that deserve attention. If the cramps are happening very frequently, several times a week, or even every night, that is a reason to look deeper. If you notice swelling, redness, or warmth in the leg along with the cramps, this could suggest a circulation issue, or even a blood clot, which requires immediate medical evaluation. Persistent weakness, numbness, or a tingling sensation in the legs after cramps can also be a red flag, pointing toward nerve-related problems. Another sign to watch for is if the cramps are affecting your daily life. For example, if you are losing sleep night after night, or if you are avoiding certain activities because you are afraid a cramp might strike, then the problem is more than just a minor annoyance. It is impacting your health and quality of life, and that means it should be addressed. It is also worth noting that new or severe cramps that appear suddenly, especially if you have other health conditions like diabetes, kidney disease, or vascular problems, should not be ignored. These situations call for a conversation with a healthcare professional to rule out anything serious. So remember this: occasional cramps that pass quickly are common, but frequent, intense, or unusual cramps can be a signal from your body that something else is going on. Paying attention to these red flags can help you act early, get the right evaluation, and prevent bigger problems down the road. So, how do doctors usually diagnose the cause of leg cramps? The process often begins with a careful medical history. A healthcare provider will ask detailed questions such as when the cramps occur, how often they happen, how long they last, and whether they are connected to certain activities or times of the day. They will also ask about your current medications, because, as we mentioned before, some of them may increase the likelihood of cramping. Next comes the physical examination. The doctor may check muscle strength, reflexes, and the appearance of the legs to look for signs of circulation problems, swelling, or nerve involvement. They might also ask you to stretch or move in certain ways to see if a cramp can be triggered or relieved. In many cases, blood tests are ordered. These can measure levels of electrolytes like magnesium, potassium, and calcium. They can also check kidney function, blood sugar levels, and thyroid hormones, since imbalances in these areas can sometimes cause frequent cramps. If there's a concern about circulation, tests such as an ultrasound of the blood vessels in the legs may be performed to rule out vascular disease. For nerve-related issues, imaging like magnetic resonance or electrical studies of the nerves may be used. The goal of diagnosis is not only to confirm that the problem is indeed leg cramps, but also to identify or rule out any underlying condition that might be contributing. For example, cramps linked to poor circulation require very different management compared to cramps caused by low magnesium levels. This is why it is so important to mention cramps to a healthcare provider if they are severe or persistent. A proper diagnosis can lead to specific strategies that actually work for your situation. In short, diagnosis is about connecting the dots: your symptoms, your medical history, your lab results, and sometimes imaging or circulation studies. When all this information is put together, it gives a much clearer picture of why the cramps are happening and what can be done about them. When it comes to treatment and general management of leg cramps in older adults, the good news is that many cases can be improved with relatively simple steps. The first and most common approach is stretching. Gentle stretching of the calf muscles before going to bed has been shown to reduce the frequency of nighttime cramps. For example, standing with your hands against a wall and leaning forward while keeping your heels flat on the floor is a classic stretch that can make a real difference if done consistently. Hydration is another important piece of the puzzle. Muscles need enough water and electrolytes to function properly. Drinking an adequate amount of fluids throughout the day, and making sure to balance electrolytes through diet can help reduce cramping. This is particularly important for older adults who may drink less water because they are worried about waking up at night to urinate. But dehydration often makes cramps worse. Massage and heat therapy can also provide relief. Gently massaging the muscle during or after a cramp helps it relax more quickly. Applying a warm compress or taking a warm shower before bed may also improve circulation and decrease the risk of cramping overnight. In some situations, doctors may recommend supplements, such as magnesium, potassium, or calcium, if blood tests show low levels. However, these should not be started without medical advice, since too much of these minerals can also cause health problems. Similarly, certain medications can be considered for severe cases, but these are usually reserved for patients who do not improve with lifestyle measures. Footwear and posture also matter. Supportive shoes that cushion the feet and provide stability can reduce strain on the leg muscles. Avoiding prolonged sitting or standing without movement is equally important, because immobility can contribute to muscle tightening and cramps. It is also important to address any underlying conditions. For example, if poor circulation or diabetes is playing a role, treating the root cause will have a greater impact than focusing only on the cramps. That is why medical evaluation is key for anyone with frequent or severe symptoms. In summary, general treatment usually combines lifestyle changes such as stretching, hydration, massage, and proper footwear, with medical support if needed. These strategies, when practiced regularly, can significantly reduce both the frequency and intensity of leg cramps, leading to better sleep and improved quality of life. Prevention is often the best medicine, and this is especially true when it comes to leg cramps in older adults. While not every episode can be avoided, there are many habits that can reduce the chances of cramps happening in the first place. One of the simplest and most effective strategies is to stay active. Gentle daily exercise, such as walking, swimming, or light stretching, helps keep muscles flexible and improve circulation. Inactivity, on the other hand, often makes cramps more likely, especially when sitting or lying in the same position for long periods of time. Another important factor is maintaining good hydration. Drinking enough water throughout the day ensures that muscles have the fluids they need to contract and relax properly. Pairing hydration with a balanced diet rich in fruits, vegetables, whole grains, and lean proteins helps maintain proper electrolyte levels. Foods like bananas, spinach, and yogurt are particularly supportive for muscle health. Good sleep hygiene also plays a role. Going to bed at the same time each night, keeping a comfortable room temperature, and stretching the legs before lying down can help prevent those sudden nighttime cramps. Some people find that placing a pillow under their knees or sleeping slightly on their side reduces the chance of muscle tightening during the night. Footwear should not be overlooked. Supportive shoes with good cushioning can reduce strain on the calf and foot muscles during the day. Likewise, avoiding high heels or overly flat shoes for long periods helps keep muscles in a healthier alignment. It is also wise to be mindful of medications. If cramps begin after starting a new prescription, it is important to talk to a healthcare provider. Sometimes an adjustment in dosage or an alternative medication can resolve the issue. Finally, paying attention to overall health makes prevention more effective. Managing conditions like diabetes, thyroid disorders, or circulation problems not only improves general well-being, but also decreases the likelihood of muscle cramps. In summary, prevention of leg cramps is about balance, staying active, staying hydrated, eating well, practicing good sleep habits, wearing supportive footwear, and monitoring medications. These small, consistent steps can greatly reduce the discomfort of leg cramps and contribute to a healthier, more restful life. While leg cramps are common and often harmless, there are situations when they may be a sign of something more serious. Knowing when to seek medical help is essential to ensure that an underlying health issue is not overlooked. If cramps are happening very frequently, such as several times a week, or if they are lasting longer than a few minutes and leaving the muscles sore for hours or even days, it is a good idea to talk with a healthcare provider. Persistent or severe pain should never be ignored, especially if it interferes with daily activities or sleep. Cramps that come with swelling, redness, or warmth in the leg may indicate a blood clot or another vascular problem. This situation requires immediate medical attention, as circulation issues can be dangerous if left untreated. Likewise, cramps associated with numbness, weakness, or tingling may point to a nerve condition that needs professional evaluation. Older adults who are on multiple medications should also pay close attention. If cramps begin soon after starting a new prescription, it may be a side effect. In these cases, a doctor or pharmacist can help determine if the medication is contributing to the problem and discuss possible alternatives. Another red flag is when cramps occur alongside other systemic symptoms such as unexplained weight loss, extreme fatigue, or frequent urination. These may be signs of hormonal or metabolic disorders, such as thyroid imbalance or diabetes, which require medical management. It is also important to seek medical guidance if cramps appear in individuals with known chronic conditions, like kidney disease, liver problems, or peripheral artery disease. In these cases, cramps may signal that the condition is changing or worsening. Finally, even if the cramps themselves are not alarming, if they cause significant anxiety, disrupt sleep on a regular basis, or reduce quality of life, reaching out to a healthcare professional is worthwhile. Sometimes reassurance, small adjustments, or targeted treatments can make a big difference. In short, while most leg cramps are harmless, the presence of severe, frequent, or complicated symptoms means it is time to seek professional care. Listening to your body and getting timely medical advice helps ensure that something more serious is not missed, and provides peace of mind for healthier living. Before we move to the conclusion, let us add some extra value by clearing up a few myths and answering common questions about leg cramps in seniors. This will help separate fact from fiction and provide practical clarity. One common myth is that only people who do not exercise get cramps. In reality, cramps can happen both in very active people and in those who are less mobile. Overuse of muscles, such as after a long walk or gardening, can trigger cramps just as easily as sitting too long without movement. It is not only about activity levels, but about balance, hydration, and overall health. Another widespread belief is that cramps are always caused by a lack of potassium. While low potassium can contribute, it is not the only reason. Magnesium, calcium, hydration levels, and even nerve or circulation issues can play a role. This is why focusing only on eating bananas may not fully solve the problem. A variety of nutrient-rich foods is far more effective for prevention. Some people also wonder if leg cramps are a sign of a serious disease. Most of the time they are harmless, but as we mentioned earlier, frequent, severe, or complicated cramps can signal an underlying condition. The key is to pay attention to patterns. Occasional cramps are normal, but sudden changes in frequency or intensity deserve medical attention. A frequently asked question is whether drinking water right before bed can prevent night cramps. Staying hydrated is essential, but drinking large amounts at night may cause frequent trips to the bathroom, which can disrupt sleep. The better strategy is to sip water regularly throughout the day, so the body stays hydrated without overloading the bladder before bedtime. Another common question is whether stretching really works. The answer is yes. Gentle stretching before bed can reduce nighttime cramps by keeping muscles relaxed and flexible. Calf stretches, ankle rotations, or simply pointing and flexing the toes for a few minutes can make a big difference. Finally, many people ask whether medications for cramps are available. While some exist, they are not usually the first option because cramps often respond to lifestyle adjustments. Doctors may consider medication if cramps are very severe or frequent, but this decision should always be made by a healthcare professional. By separating myths from facts and addressing these common questions, seniors and their families can feel more confident about managing leg cramps. The key takeaway is that knowledge, balanced habits, and awareness of warning signs go a long way in making life more comfortable and healthy. We have covered a lot of valuable information today, so let us take a moment to recap the key points about leg cramps in seniors and how to prevent them. First, we learned that leg cramps are sudden, involuntary muscle contractions that can strike at any time, but are especially common at night. They're often painful, disruptive, and can leave muscles sore afterward. While they are usually harmless, they can also be a signal of dehydration, nutrient imbalances, or underlying health conditions. Second, we explored the causes and symptoms of cramps. These range from dehydration and low levels of magnesium, calcium, or potassium, to circulation and nerve issues. We also learned that cramps can appear with warning signs such as swelling, numbness, or persistent pain that require medical attention. Third, we discussed practical strategies for management and prevention. Staying active, drinking enough fluids, eating a balanced diet rich in essential nutrients, stretching before bed, wearing supportive footwear, and being mindful of medications all play important roles in reducing the likelihood of cramps. Prevention is not about one magic food or one single habit, but about a healthy balance of lifestyle choices. Most importantly, we focused on the top 3 foods that can truly help prevent leg cramps in seniors. Bananas, which are rich in potassium and help muscles contract and relax properly. Spinach, which provides magnesium to support nerve and muscle function. And yogurt, which is packed with calcium and protein to strengthen muscles and maintain balance. Including these foods regularly in your diet can be a simple yet powerful way to reduce cramps and support overall health. We also addressed myths and frequently asked questions. We learned that cramps are not only caused by lack of exercise, potassium is not the only nutrient involved, and that occasional cramps are usually harmless. Stretching, hydration, and varied nutrition remain the best strategies. And while medications exist, they are not the first line of defense. So, if you remember just 3 things from this video, let it be these. 1. Leg cramps are common, but often preventable. 2. Balance in hydration, nutrients, and activity is the key to muscle health. And 3. Adding bananas, spinach, and yogurt to your diet can make a real difference for calmer nights and stronger days. With this knowledge, you can take small daily steps that add up to meaningful improvements in comfort and quality of life. Thank you so much for staying with me until the very end of this video. I truly appreciate the time you have dedicated to learning more about your health, and I hope this information helps bring you comfort and confidence in managing leg cramps. If you found this video helpful, please give it a like. Your support means a lot, and it helps this channel reach more people who may also benefit from this knowledge. Do not forget to subscribe and hit the notification bell so you will not miss any of our future videos. This channel is full of medical and educational content designed to make health topics easier to understand and more accessible to everyone. We will continue exploring practical tips, science-based advice, and simple steps you can take for better health and well-being. I also want to invite you to share your thoughts in the comments below. Tell us if you have experienced leg cramps, what strategies have worked for you, and what topics you would like us to cover in future videos. We will be highlighting and giving a special greeting to some of our new subscribers and the best comments at the end of upcoming videos. So do not miss the chance to join the conversation. Remember, this content is educational only and does not replace professional medical advice. If you are experiencing severe, frequent, or concerning symptoms, always consult your healthcare provider for proper guidance and treatment. Once again, thank you for being here with me. Take care of yourself. Keep making small, positive changes every day, and I will see you in the next video.